Hello, my name is Beth Bador, and I'm the Kidney Goddess. And I have a support group. If you're watching this, you probably know about it already. And you can find me on Facebook under Beth's Kidney Support Group. And today we're talking about how we cope with kidney disease. So let's start from the beginning. How we cope, how we cope with kidney disease is generally how we cope with anything else in our lives. There's usually a pattern to how we deal with things, adversity, things that we might consider negative. So just think about that. Go back and think in your mind, how have you dealt with other things in your life? And how does that apply to your kidney disease? So after you do that, are you the type of person that feels like your glass is half empty? It's not refillable. Are you the type of person that you think the glass is half full and I can even refill it? So again, when we're talking about kidney disease specifically, because this is a kidney group, but it can apply to a lot of different things as far as our health goes or situations in our life that can be stressful, is how do you think about life in general? Are you a positive person or are you generally more of a negative person? So if you're a positive person, you're going to handle this a lot easier with less stress than if you're a negative person. However, I'm not saying it's not a stressful situation. Oh my goodness, there is so much to kidney disease. It affects everything. It can affect how you deal with your religion, how you think about God. It can make you think about work. What am I going to do about work? How does work fit in? How does my love life fit in? If I'm connected to this machine at night and I have a partner, I'm married or a partner, how does that work out? Can we still sleep in the same bed? What about sex? People don't talk much about sex, but sex can be an issue, especially if you got drains and tubes and everything sticking out of your body. Some people might think, how sexy is that? I have PD and I have this thing sticking out of my belly. And, is my partner going to think that's sexy? And how are we going to deal with that? Just general day-to-day things that we have to deal with. We have to deal with things differently than other people have to deal with. I don't have to really tell you people, you know what's going on, but your medicines and how it affects your sleep and what you're supposed to eat and what you're not supposed to eat and your exercise and all different frames of life has to do with pain in your body. Maybe something with kidney disease is creating pain and suffering in your body. And pain and suffering is two different things. Pain is your body giving you information about what's going on, and suffering is how you relate to the pain. So think about that one if you haven't before. So it creates a lot of, let's say, opportunities in life. So number one thing is how you deal with these type of things on a regular basis, your pattern. Then think about your support system. Do you feel like you have a support system that supports you through all this? There's lots of doctor's appointments that you have to go to, a lot of procedures, some things you can't drive yourself to, you can't take yourself home from. So think about your support systems when it comes to family and friends. So do you have a big support system? Do you have a family that can help you? Do you have friends that can help you? Do you have a partner that can help you? Do you have kids that can help you? I apologize about some of the stuff going on with my nose. I just had a nose procedure done today, but I'm feeling better. I'm looking better. I had my deviated septum fixed, so now you can see it looks better. Hopefully I'll sleep better. Okay, I'm digressing. So if you think you have family support, do they know how to support you? Maybe they don't. Have some of them gone to the kidney education that they have? When you're trying to get into a transplant list and at a facility, you're caregiver has to go through. Maybe it's a half a day, a full day. I don't remember how long it is. It's probably different at different facilities, but they get educated with what you've gone. And do you share that with the other people that's going to be involved with your caretaking? With your friends that want to know, how can I support you? So do you expect people to just know what to do? Well, I thought he would know that. I thought she would know. How can they not know that? How can they treat me that way? Did you tell them? Did they ask you? How can I help you? How can I support you? What do you need? How do you want me to listen to you? When you're feeling down, how do you want me to help you feel better? Have those types of conversations. Open them up now before you're at the situation where you really have to dealing with it, where it's face to face and they don't know how to help you. And maybe there's arguments around it. Maybe there's tension in the house because of it. There could be so many different things. So first, be open and have conversations of what you expect, what the facility expects, what your doctors expect, and see, what the other person says. Have a conversation so you can decide if you're going to agree on all those things, or if there's some things that that person just doesn't want to do or doesn't want to help you with. I had to think when I had my first transplant that didn't work from day one, that my son was helping me out a lot. Now, did I feel comfortable with my son bathing me or helping me in a shower? Personally, I did not want him to feel that way. Yes, he is family, but for me, that was crossing the boundaries, that if I could have anybody else in the world help me, I'd rather do that than put him and I in that situation. For me, that would be uncomfortable. Maybe for you, it's different, and that's fine. If you think family is family and they both feel that they can help you out, let them help you out. Let them support you. In this world, especially women will say, I can do it. I can handle it. I don't need your help. I'm so sorry about my nose. I can handle it. And you don't have to be that way. So first, around support. Where do you have support? Now, let's say you don't have a lot of family or friends and you're feeling isolated. Where can you get support? There is in-home care. There are CNAs. There are sitters that can come in, and different agencies can help you with these things. You can start with your social worker, and there's also agencies that can help you with that. So you can reach out to different organizations, and especially the social worker, and the Department of Health and Human Services may be able to help you. Those are a few places that I've gone to that has helped me. So now you're looking for support. So coping with it. Let's talk about eating restrictions. When you see the list of things that you can and cannot eat, how do you feel? Do you feel restricted? Or do you focus in on the things that you can control, that you can be aware of? I'm going to put this on pause for a minute. I hope you bear with me. I just had to get my nose taken care of today, and I'm not going to go into details, but it wasn't pleasant. So I'm going to keep my napkin close to me. So bear with me here. I'm a little drippy. So anyways, so let's get back to you and kidney disease and coping with kidney disease. I'm coping in this moment, kind of feeling embarrassed with what's going on. That's life, right? So we're talking about food. So I want you to think about all the food that you enjoy that they say you can eat. Get a list of all those things you can eat rather than just things that you can't eat. Put them on your refrigerator. And there's several places that you can go to get assistance with this. DaVita is where I go. So I can go to DaVita recipes, or you can go online, kidney recipes, cookbooks, those kind of things. Talk to your friends that have kidney disease. What do you eat that's on the list of things that we can eat? And really focus on that. So if you are the one that goes grocery shopping, look at that list, create some recipes from that list that you enjoy, and look in your fridge, look in your cupboards and see what you have. And then start making those meals. Start thinking about how pleasurable it would be. If your phosphorus can go down, if your potassium can go down, all those things that you might have on your labs that aren't very helpful, that may even kick you off the kidney list. I was told the other day that if my potassium still remained a little bit high, that I could get a kidney, I could go in, they could do some blood work and send me home because my potassium was too high. And that's serious when you're talking about surgeries and potassium in your system. So I could even be sent home for being over the limit. So think about all those different things and start feeling joy about what you can eat and why you're eating that way. If you are on a transplant list and you plan to get a transplant, you won't have those restrictions forever. So think about this. This is just temporary. This is going to make me feel better. With me, it's restless legs. If I have too much phosphorus in my system, then my legs get restless. And that's not fun at all, especially when you're trying to sleep at night. Let's talk about exercise. Have you been a couch potato? And now the doctor says he wants you to lose weight and he wants you to exercise because it's going to help you through the transplant. If you're overweight, you're over your BMI, they may restrict you from getting a kidney or even being on the list. So you got to get moving. How do you feel about that? Are you somebody that enjoys moving, or are you used to sitting on the couch and watching TV? Maybe you feel like you don't have the energy. Maybe you're sleeping more. Maybe you don't have the motivation. Whatever your situation is, you need to step left or shift left is what I call a massive change. You need to think differently about exercise. You need to change your feelings about it and your behaviors, and you need to put it on your calendar. It's a must, just like we have to brush our teeth. Well, you don't have to, but your teeth will fall out. We need to brush our hair or take care of our scalp if we don't have any hair. If we need to wear glasses, we have to wear our glasses or I won't be able to see you. You'll be fuzzy out there. So think about all those things that you already do for your health. Well, this is just another thing for your health. And trust me, when you get the right type of exercise for where you're at now with your doctor's permission, I should say that, whenever you're changing a routine with your doctor's permission, especially if you're on a transplant list or trying to get on that transplant list, get your doctor's permission. Because there might be things you have to do if you're a cardiac patient also, or a diabetic patient also. There's several things to think about, especially if you've never exercised before or in a long time and you're just starting. Then people need to meet you where you're at. So if you go to a trainer, let's say, they need to understand kidney disease. Just not any trainer can train you. No, I'm a physical therapist. I have been an exercise specialist. I have exercised all my life. And I have gone to trainers. I fired some trainers because they don't know what's going on with kidney disease or with my body. And they push me too hard and then I suffer. Or if I go to a yoga class where I feel like they're pushing me too hard and they won't let me listen to my body, I leave. I don't put up with that. They don't know about my body. I'm the one who knows about my body. I don't let anybody else control how I feel with my body. I know how I feel. So what do you enjoy when it comes to exercise? You say, oh, I hate to exercise. Well, what kind of things did you do when you were young that you really enjoyed? Did you like ice skating? Did you like basketball? Did you like dancing? Did you like jumping rope? Did you like playing hopscotch? I mean, it could be now we see my painting. You don't need to see all that. So you can see my painting though. I'm a painter, so that's okay to see. And as I digress. So do something that you used to love. Start with something basic, something simple. It doesn't have to be big. If you are in a wheelchair and you can't stand up and walk, you can do exercises lying down or sitting up. Let's say you feel like you can't do much exercise at all. What about breathing exercises? Breathing exercises are so important. Even for people that are athletes, should be doing breathing exercises. There's many different ways to breathe. Look it up on the internet. Go to a yoga class, go to a breathing class, and they'll teach you about exercising. And breathing itself can help your mental status and your health, believe it or not. So we talked about food. We talked about how we deal with things. We talked about exercise. So let's say you are a negative Nelly, as I call it, somebody who sees the glass half empty, not refillable. This is terrible. This is the end of my life. There are many things that you can do if you choose to do them to change your mind, to change your view, to put on a different type of glasses, rose-colored glasses, blue glasses, whatever kind of glasses you want to put, sparkly glasses, ones with diamonds, and it can help you to see the world differently. Even though you have the same body, you're going through the same physical things, you can change how you feel about it, how you react to it, be proactive instead of reactive. And you may need some support around this. You may need a support group. Have you ever thought about getting on the internet or finding out the local hospital? Do they have any in-hospital support systems? Now, right now with COVID, there's not too many. They're mostly online. And like I said, I have my Best Kidney support online. And with mine, you have to send me your email and your name in order to get the link to Zoom so nobody can bomb Zoom meetings during the class. So you want to change your mindset, your behaviors. And if you're a person who believes in auras, in chakras, in energy, changing your energy. When you start thinking clear, when you start feeling better, when you're starting to have more positive thoughts, your vibration in your body goes up. Now, some of you might not understand what I mean when I say energy. So I'll give you a for instance. Have you ever gone into a party and felt the party atmosphere? And some people really like that feeling. Some people don't. They're more of a introverted type person. But when you feel the crowd, generally in a party, people are happy. Happy birthday. Happy to see you. Happy anniversary. Whatever the situation. And everybody is usually mostly happy. Now, when you go to a funeral, how do people react? Are they happy? Most of the time, they're not. They're suffering. They lost a partner. They lost a parent. They lost a friend. And they're grieving. They're really sad. Maybe they're even depressed in the situation. So when you go into that room, how does that room feel to you? Does it feel like it's the birthday? It's the birthday? No, right? Gloomy, sad, crying. Does that affect how you feel? Well, that's the energy of the population, of the community of people. That's the whole thing that's going on, generally how that group feels. And if you're somebody who feels energy or an empath, that's going to affect how you feel. So I want you to think about that. Start increasing your vibration by increasing your thought patterns of being positive and changing your behaviors. So you might say, how can I be positive when I have kidney disease? They won't let me on the list. I feel terrible. I have pain. I can't work. Whatever your life situation is, I still would suggest to write a gratitude list of all the positive things and start making little shifts. You may need to go to a counselor. You may need to go to a psychiatrist if you need medications around depression, anxiety. I'm not pushing for anything. I'm a life coach. I'm a transformational life coach. because I was feeling very depressed, feeling a victim to this life circumstance. And I wasn't going to do any of this. I wasn't going to go on dialysis. I wasn't going to get a transplant. I was ready to exit and I was going to go on hospice. And someone told me they really loved me. They thought that I was such a positive, wonderful person. And there was more for me to do in this life. There was lots of people who loved me. So at least try it, Mom. Just try the dialysis in the clinic. See how you do. So I made up all these assumptions. I'm a physical therapist. I work in clinics, in long-term care centers, that I had to take care of patients that just went to dialysis. Then they have to come and exercise. How do you feel after dialysis? Do you want to jump up and exercise? Not everybody wants to exercise. Not everybody enjoys it. Not everybody feels it's needed. Now, I do think it's needed. So think about those things. So he told me those things and I had to totally change my mindset. It was a 180. And I have a 5-step program with my coaching services that shows people how to go from feeling a victim, wounded, trauma, to feeling a champion, to feeling a victor in their life. And if you saw me, which you are, and if you knew me in person, you would say, I don't believe you have kidney disease. I don't see that. You are the happiest person I know. And I am dealing with a lot of the same things that you may be dealing with right now. Now, maybe not all of them, but I went through a transplant that didn't work from day one. I'm back on dialysis. I've gone through some stuff, some big stuff. So let's not compare one another. Let's not compare a lotus to a rose. We all have different lives and different life situations. However, I chose, if I was going to stay on this earth and do dialysis and try to get a transplant, I'm going to change my language. That helps too, change your language. I'm going to get a transplant. It's all part of the process. All part of the glass is refillable. You don't have to even refill it with the same stuff. You can refill it with what you want. Unless you're trying to get on the transplant list and you're not supposed to drink orange juice and all that stuff. So let's get back to what we're talking about. So yes, all those different things will help you to feel differently about what's going on, especially if you have a good support system. If you have a good support system with your family and friends, and support system with people that understand what you're going through. If you have a friend or a support group that they have the same stuff going on. So you don't feel alone. With this disease, I think a lot of people feel lonely. It's only happening to me. Oh, another good one is, why is this happening to me? What did I do? Why is this happening to me? I've learned in my life really not to ask why. There are circumstances in life where you should ask why. Like, what happened that my marriage dissolved in divorce, that it didn't work out? Yeah, I think you should sit back and analyze it and see, how were you part of it? What did you put up with that you shouldn't have put up with? All these different things. But when you're talking about something like, why did this happen to me? And in my situation, they said it was genetic. Now I could get into a whole story about that, about why I believe in different diseases and what goes on. If you want to talk to me about chakras and auras and vibrations and past lives and all this other stuff. But for today, I'm going to say that polycystic kidney disease is a genetic disease that I got from my father's side of the family. So if you have that, it's going to affect your life. You're going to have stuff going on. But I choose to look at the positive side of life and getting support where I need it. Even when I need support, even though I am a coach myself, if I need more support to either validate myself, which I'm getting better at validating myself. Once you start getting that process of validating yourself, you don't need the outside validation as much. But even I still have to go to people and say, this is how I'm feeling and I'm not managing it very well. Do you have any other tools or suggestions of way of thinking? So there's that. Then if you want to get into more specifics is the vagal nervous system. And I'm not going to go into a lot of that today. But if you are having difficulty managing the disease, if you have depression or anxiety, depression is usually something that's happened in the past that's affecting you now. And anxiety is something that you're worried about in the future, something you fear in the future. And when you can live in the present moment, in the now, dealing with this moment right here, I'm talking to you right now. This is where I focus my attention. I don't focus it on, what's going to happen after this, and am I going to be able to sleep tonight? And I'm not going in the past of, well, when I was kindergarten and I blew my nose and da 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 da, and I was so embarrassed. All these boogers came out and everything. So I'm not going back to the past. I'm here with you right now. That generally you can learn to validate yourself, but sometimes you need to go and get support, either to validate yourself or to get support around whatever you're going through. Don't do it by yourself. You don't have to. I'm not telling you what to do. I'm suggesting don't do it by yourself. Get some help, get some support. So for today, I think that's enough conversation. It's been maybe about 30 minutes of conversation here. And I would love to have some more dialogue with more people around this conversation. I am going to put it out on Facebook now on the kidney support group. You can go there. I may put it on other forums. I have so many other forums out there. Like I said, you can find me on Facebook, Beth Bedore. You can find me at my website, thecreativelifebydesign.com, where I offer several other things. Trust me, I'm an artist and a creator of things, and I wrote some books about kidney disease that might benefit you or your family. Think about that one, especially the workbook too. My first book was Never Say Never, Living with Kidney Disease from Victim to Victorious. I have a whole workbook and journal around that, and my 5-step program, how I went from that victim mode, why me, I feel sorry for me, to I'm enjoying life no matter what my circumstances are. I'm going to look and see the light. There's always a silver lining, because I choose my life to feel that way. I only have this one life right now, and so do you. So that's my last comment to you, is how do you want to live the rest of your life? Now, if you choose to stay in victim mode and not cope very well, that's your choice. And if you want to be more peaceful, in harmony, more happiness, more joy, stick with the band Train with me, and join me in all my conversations out here. Enjoy the support group and all my other things that I'm doing out there, because I'm here to support you and facilitate you to have the best life ever. Thanks, guys. Have a great night, and I hope to see you next week on Facebook, on Zoom. It's generally Tuesdays, Eastern Standard Time at 7 p.m. And next month, we're going to have a naturopath doctor. Her name is Michelle Drains, and she's going to talk to us about medicine that is the naturopathic philosophy to kidney disease. And again, I state, talk to your doctor, don't make any changes, but it's always good to have information and gain knowledge and wisdom. Have a good night.